I never made it, but I know what it takes. I'm motivated by a mix of emotion. Got my statement, and I'm reading it slow so I can understand it fully. Appreciate my standing, go out of this world and right on time. Oh, never in my life have I seen the sky light up like this.
Good afternoon.
Good afternoon, sir.
So this is the last session for our topic regarding Ebola and the Marburg viruses. Okay? So the main lecture, the main topic for this afternoon is we have your guidelines for prevention and control of your Ebola and your Marburg viruses. Your Ebola and your Marburg viruses, these are viruses that belongs to the Filoviridae family of viruses. Okay? Filoviridae family of viruses. Your Ebola virus, which is formerly known as your Ebola hemorrhagic fever, while your Marburg virus, this is more fatal and more virulent compared to your Ebola. And your Marburg viruses is also in the same family that causes the Ebola virus. Okay, they're just in the same family. These two viruses or these two diseases causes rare but severe and often fatal illness to humans. Okay, fatal illness to human. And it usually affects persons and non-primate humans like your monkeys, your chimpanzees, as well as your gorillas. Okay, these are the most common that affects your Ebola and your Marburg viruses. Your Ebola and your Marburg viruses causes a hemorrhagic fever. Okay, there are many kinds of diseases that causes hemorrhagic fever. One of which is we have your dengue fever. Okay, hemorrhagic fever that is characterized by extensive bleeding, multi-organ failure, and in most cases, patient will die. Okay? Now, let us talk about the ecology and transmission of your, by the way, the fatality rate for your Ebola virus is around 65%, while for your Marburg virus is around 88%. So the fatality rate is very high. The chances of living or surviving the viruses once you get infected is very low. So let's talk about the ecology and your transmission of your Ebola virus. Evidence show that the main reservoir host for your Ebola viruses is we have your bats. Okay? Specifically your fruit bats. Okay? These fruit bats could infect other animals like your gorilla, your chimpanzees, and your antelopes, porcupines, monkeys, as well as humans. Okay? Once the reservoir host already infect or transmit the infection to other animals as well as to humans, that is what we call as your spillover. Okay? Now, this type of transmission is what we call as your primary transmission. Because we have two types of your transmission. We have primary and we have your secondary. So this type of transmission is what we call as your primary transmission. Now, if this human or if this infected human infects or spread the infection to other human, that is what we call as your secondary infection. Okay? How does secondary infection happen? Let's, for example, for healthcare workers, especially if you're not going to wear appropriate PPE or if you're not going to protect yourself, you came in contact with a suspected and confirmed cases of Ebola patient, the risk of acquiring the infection is very high. Okay? Aside from that, if you're going to take care of a person, dead or alive, especially if you came in contact with their blood and body fluids, you might also acquire the infection. If you came in contact with surfaces contaminated, patient's clothing or items that is contaminated, you might also acquire the infection. Now, there are also suggestions or evidences or studies that suggest or tell us, especially for males who survive Ebola, the virus could still stay in their semen for around 12 months. That is why, according to WHO, males are advised not to take or not to have a sexual intercourse or have sex for at least 12 months. Okay? Not unless if there is already a confirmation or laboratory result on two different occasions that their semen is already tested to Ebola, and it is negative already. There were no studies or researches that vaginal fluids or from women, it can be transmitted, only for men. Okay? Now, your Ebola virus, it cannot be transmitted through insect bites. Do you follow? Now, primary transmission, main reservoir to other animals and to humans, that is what we call the spillover. This is now your secondary transmission. There are also reported people that survive Ebola virus. Okay? Now, those people who survive Ebola, they complain after surviving, after recovering, they complain of muscle pains, some symptoms that they had when they were still infected with the virus. But the main challenges, the main challenge that they acquire after surviving Ebola is the stigma from the community. Okay? The people will look at you as you are infectious already. Just like we have hepatitis C or HIV. The people will look at you differently. You are not normal anymore. So that is the main challenge that they face after Ebola virus infection. How many days does a person infected with Ebola virus, how many days will be the incubation period? From the time of exposure until the development of any signs and symptoms?
2 to 21.
That's 2 to 21 days. That's your incubation period. Incubation period, first time that you have been exposed, until the development of any signs and symptoms, this period is what we call as your incubation period. Okay? Do you follow? Now, you cannot transmit or you cannot spread Ebola virus if you do not manifest any signs and symptoms. You can only spread the virus once you already have signs and symptoms. Now, talking about your signs and symptoms, these are the different signs and symptoms of your Ebola viruses. It comes in 3 phases. First phase is we have your general phase, that is 1 to 5 days. Fever subjected or recorded 38 degrees Celsius or more. There is severe headache, severe malaise, muscle aches and pains, chills, severe watery diarrhea, abdominal pain and cramping, nausea and vomiting, rash and ananthem. Now, this phase is described as ghost-like drawn pictures, deep set eyes, expressionless faces, and extreme lethargy. Usually, during this phase, the patient will suffer severe dehydration. So, if you have a severe, if the patient is experiencing severe dehydration, most probably the patient will be lethargic. Okay? Now, the second phase is we have your early organ phase. From 6 to 13 days, there is still fever. From watery diarrhea, it becomes now bloody diarrhea. Hematemesis, petechiae, ecchymosis, mucosal hemorrhage, visceral hemorrhage, conjunctival infection, edema, apathy, depression. And this phase is also described as your bleeding phase. Okay? Because the patient now is bleeding. It's not watery anymore. Then the last phase of your the signs and symptoms is we have your late organ phase from 14 to 21 days. It is described as CNS involvement because the patient still has fever from the first day until 21 days of infection. There is observation, just like the patient is difficult to arouse. The patient has dementia, coma, convulsion, DIC, metabolic disturbances, shock. There are some reports that the patient might have bronchitis. And last is the patient might have psychosis. Okay, that is why it is called as your CNS involvement space or phase. So if you don't have any kinds or if you don't have any of these symptoms, you cannot transmit or spread the infection. Do you follow? Next is the case definition. This is very important since we are working in the healthcare facility. So for us to be easily to identify and contain the virus, we should know how to detect Ebola virus clinical signs and symptoms. Do you follow? Now, for your suspected case, it should have a clinical criteria as well as epidemiological risk factors. Okay? So what are those clinical criteria? We have your fever. We have your body malaise. We also have your muscle pain, abdominal pain, severe headache. Patient will have diarrhea, vomiting, and unexplained hemorrhage. Now, if the patient has this clinical criteria, you should correlate it with the link. Same with your MERS-CoV, your COVID, there is link, right? So what are those? Epidemiological risk factors. So for example, if you came to or visited, traveled to some areas where there is outbreak, where Ebola virus is endemic. When I say endemic, it's routine already or it's common already in that place or area. Aside from that, if you came in contact with infected animals, okay? So those are some of the factors that we need to consider. Because these clinical criteria, it could happen or it could be present to some of patients who have hemorrhagic fever. Okay? So we need to link it with this, with the criteria or factors that we have mentioned. Do you follow? I think what we have right now, why they are pushing back again the Ebola virus regarding dissemination and education, because there is an ongoing outbreak in Uganda. Okay? Just this year, just this month, 2022 October, there was an ongoing outbreak of Ebola virus in Uganda. Okay? Now, when I talk about confirmed case, that is a suspected case, meaning to say not only clinical criteria but also epidemiological risk factors, plus your laboratory confirmation. That is your confirmed cases. So it's very important for us to know these things because in order for us to limit the spread of infection, or we can easily contain, it cannot enter anymore to the hospital. From the triage, from the entrance in the ER, we are able to contain the virus. Okay? This is more scarier compared to your COVID-19 or any other SARS-CoV viruses. Do you follow? Next is, what are the infection prevention and control methods that we need to apply? So this is very important. Now, let's start with your patient placement and isolation. What are the precautions for Ebola virus?
Isolation room.
Isolation room?
With
That's,
the
yeah.
PPE.
Yeah.
With
Precaution.
contact.
What's the precaution?
Contact.
Contact and?
And
Contact and?
blood.
No. Contact and?
Air.
Air? Contact and what? It's contact precaution. This is for suspected and confirmed cases. Contact precaution, and we have your droplet precaution. Why? Because your Ebola virus could be transmitted through any infected blood or body fluids. So for example, if the patient will cough or sneeze or whatsoever, those are body fluids as well. Right? So it should be contact and droplet precaution. The patient should be placed in a single room with a toilet and a hand washing facility. What else? Most equipment for routine care are stored inside the patient's room. Example, your BP apparatus, your stethoscope, or any other supplies or equipment that is routinely used with that patient, just keep it inside the patient's room. Okay? And restrict the entry of any personnel that is not assigned to that patient. So those who will be assigned to that patient should only be the one who will go inside to that room and to take care of that patient. If you are not assigned, do not go inside. And as much as possible, if we have any suspected or confirmed cases of your Ebola virus, we need to choose or to limit the number of staff who will take care of that patient. Why? So that we can also, for us to easily contain those staff, for contact tracing, very easy, and to minimize the spread of infection just in case there will be any infection that will happen to those who are going to handle those kinds of patients. So let's for example, in GICU isolation, so we're just going to limit to 3 or 4 staff and 1 doctor or 2 doctors who should see that patient, and they should not see another patient as much as possible, only that patient. Okay? Now, for your personal protective equipment, now due to the nature of the transmission of your Ebola viruses, PPE is very important. Okay? Let us talk first with your gown and your coverall. If you have coverall, you can use that one. If you don't have coverall, you can use the yellow isolation gown. You follow? Either of the two you can use. It is important, this one, to protect the skin and your clothing since it can be transmitted through contact. Remember, the most important PPE for our contact precaution is we have your gown and your gloves, right? Gowns should be used in addition to head cover. If you are not going to wear coverall, because in coverall there is already a hood, right? You need to use cap if you're just going to wear your yellow gown. And material should be fluid resistant and impermeable. A single-use plastic apron can be used when the patient is experiencing vomiting or diarrhea for additional protection. Okay? Next is we have your full face shield. It should be full face shield to fully protect your entire face from any splashes of blood and body fluids, not only goggles. Next is we have your mask or your respiratory protection. Since the precaution that we are going to apply is droplet, so your medical mask is very important. If you are going to perform AGP, then you need to raise the level of your precaution to airborne, and you need to wear your N95 mask. Do you follow? Okay. Next is we have your gloves. Now, you are going to wear two gloves. We have your inner gloves and you also have your outer gloves. Okay? Now, how to wear? Let's for example, your inner gloves, you're wearing your gown. The first glove, the inner glove should be inside, under your gown. The second glove, which is the outer glove, should be above your gown. Do you follow? Next is we have your rubber boots. If you have rubber boots, it would be better because it can offer better protection compared to your shoes. But if you don't have any rubber boots, make sure that your shoes should be completely sealed and non-slippery. Okay? Inspection and body system. It is advisable that you have someone who will assist you during the donning and doffing procedure. Okay? Body system to inspect also for your PPE. If there is any damage or hole, at least somebody will tell you that your PPE is not, the quantity is not good anymore. And somebody will tell you that what you are doing is incorrect, so that you can change your practice. Because sometimes, due to the nature of our, human nature, we are going to make it very fast. We tend to forget sometimes that as long as we are going to wear the PPE, but we forget already the correct sequence, especially during the removal process of our PPE, okay, which is very critical and important. Now, the donning sequence. First is remove personal belongings such as your watches, jewelry, and rings. And wear medical scrubs. Do not wear any outside clothes or abaya if you're going to take care of this patient. And rubber boots should be done. Avoid regular footwears as much as possible. Rubber boots. Next is we have your coverall. Wear coverall until here. Do not yet put on the hood. Okay? As you can see, the patient or the staff did not put the hood first. And if you're not wearing coverall, you can wear your yellow gown. Next one is we have your put on your medical mask. Then after is we have your face shield. If you're going to wear coverall, put on the hood. Do you follow? If no coverall, put the cap. Okay? Gown, yellow gown, face mask, face shield, then the cap. Then last is we have your gloves. As what I have mentioned, first glove under, second glove above your gown. The same sequence in donning your PPE. From down, going up. Do you follow? That's the sequence in donning your PPE if you're going to handle patients like this. Now, the doffing sequence. First is inspect PPEs and disinfect outer gloves with registered EPA disinfectant. Now, you're going to remove now your gloves. You're going to doff your PPE. First is, you have your outer gloves, right? Disinfect the outer gloves. Okay? After disinfecting the outer gloves, remove the outer gloves. Now, the manner in removing your outer gloves is the same manner as if you're just wearing one gloves. Okay? Avoid touching the inner glove. Okay? Remove, then inside. Okay? Avoid touching the inner gloves. The outer gloves is contaminated, right? So avoid touching, the outer areas of your gloves is contaminated. So avoid touching the outside parts of your PPE. Now, you remove already the outer gloves. After removing the outer gloves, disinfect the inner gloves again. Okay? After disinfecting, you lower the hood. Do you follow? Lower the hood if you're going to wear coverall. After lowering the hood, unzip. unzip the coverall. Then, remove from inner to outer. Okay? After that one, the same process, inner to outer. Once you already remove your coverall, the same manner in removing also your gown. Okay? Every after removal of your PPE, you need to disinfect your inner gloves. Just like performing hand hygiene, every removal of your PPE. After your gown or your coverall, if you have head cover, then disinfect. Next is we have your face shield, disinfect again. Next is we have your face mask, remove from the strap, okay? From the strap of your face mask, then disinfect your inner gloves. After disinfecting or after removing your mask, disinfect your inner gloves, then remove your inner gloves last. Okay? Then perform hand hygiene. Do you follow? So every after removal of your PPE, disinfect your inner gloves. That is why a body system is very important. Okay? So that somebody will remind you or tell you, disinfect. Do you follow? Now next is we have your environmental and your waste management. Which bag are we going to dispose the waste of a patient that is a suspected or a confirmed case of Ebola virus?
Yellow.
Yellow or black?
Yellow.
It should be in yellow. Why? Because your Ebola virus is a highly infectious disease. There should be no black inside the patient's room. All yellow. Next is the duration of infection control precautions. Now, the duration of your precaution or isolation of the patient is, there's no specific date or no specific time, but we're just going to base it on following factors. But it is not limited to these factors only, okay? These are just some of the factors that we need to consider in order for us to discontinue the patient's isolation. First is presence of symptoms related to Ebola or Marburg hemorrhagic fever. If there's no symptoms or if there's still symptoms, do not discontinue. The date symptoms resolved. Other conditions that will require specific precautions. So for example, if the patient has Ebola, but the patient also has tuberculosis, try also considering the other conditions of the patient before you stop the isolation. The patient has Clostridium difficile, okay? And it's not yet treated, so you need to consider that one also before you cut or you stop the patient's isolation. And if there is already available laboratory information, then you could also consider this one to stop or to discontinue the patient's isolation. Do you follow? Now, how do we manage patients if we have patients who died here in Al Jazeera Hospital? It should be handled by a trained personnel. Okay? Who are those trained personnel? Security. They are very trained. Okay? Now, what else? Do not wash or clean the body. Okay? Do not do anything to the body anymore. And do not do or do not perform any autopsies unless it is necessary or requested. You should wear all your PPEs. Okay? Your PPE will serve as your first line of protection. So, wear the appropriate PPE properly and correctly. Do not remove any inserted medical equipment. So, if the patient has cannula, the patient has ET tube, just leave it there. Do not remove it anymore. And double bagging. So how do you bag patients who died, suspected or confirmed case of your Ebola? Now let's for example, this is the patient's body. This is the body. Put the first body bag. Okay? After putting the first body bag, disinfect the surfaces of the body bag. Then after disinfecting, put it inside the second body bag. Okay? Then disinfect after. Do you follow? Do you understand? That's double bagging. So see how critical the precautions is. And label with highly infectious material and directly or immediately move to mortuary or cemetery. Now speaking of body bag, we also have specifications for your body bag. Now your body bag should be impermeable and vinyl. The thickness of your body bag should be 400 microns thickness, and it should have 4 handles, so that it is easier for the one who's going to take care of this body to carry it. And the body bag should carry the weight of at least 100 to 125 kilos of weight of the person or the patient inside. and provide full containment of bloodborne pathogens. Make sure that your body bag will not drip. The blood or body fluids inside should not drip outside the body bag. It should contain all any blood or body fluids of the patient. Now, diagnosis. As what I have read, usually you can diagnose or you can, for laboratory testing and information, the PCR testing for your Ebola virus. And Ebola or Marburg viruses is detected in blood only after the onset of symptom, and it may take up to 3 days for the virus to be detectable in clinical samples. Now, let's for example, I came today. I am a suspected case of Ebola. Today is my first day of any signs and symptoms. Most probably, you cannot detect the virus during the first day of your symptom. So you need to repeat it again after 48 hours on the third day. Okay? What else? Collect 2 samples with a minimum volume of 4 milliliters of full blood in rectal blood collection tubes, 1 ml for pediatric. Okay? Use serum separator red top cap tube with gel for antibody testing. 3 serum separator tubes are required to be collected for each case. Blood must be collected in plastic tubes. Please not use glass tubes. Healthcare workers who withdraw samples. Healthcare workers, especially you, because samples, these are blood, right? So you need to wear appropriate and complete PPE. Same also with the one laboratory staff who is going to handle the specimen. It should be later. The specimen container should be decontaminated with an approved disinfectant before transfer outside the collection tube. Your Ebola virus is a highly infectious disease or virus. After collecting the sample, do not put in your pocket. Do not put in your logbook. Okay? Put it in a biohazard bag and put it inside the container. Do you follow? Okay? But later on, I can find out. Now, reporting. Reporting is very important. As what I have mentioned, your Ebola is a highly infectious disease or infection. It should be reported within 24 hours. No delay. Immediately. Okay? So, all healthcare facilities should report. If we are not going to report it as soon as possible, there are some laws that will punish the hospital because these are notifiable diseases. Okay? This is, it has laws that we need to follow. And contact tracing. Contact tracing is very important so that we can minimize and contain the spread of infection. Contact tracing will help us to identify people who came in contact with the virus so that we can isolate them and we can follow them. So how do we define contacts? These are people who have direct physical contact with the patient, dead or alive, such as providing care, especially for healthcare workers, living in the same house as the patient during his symptoms, had contact with the patient blood, body fluids, or clothing. Healthcare workers exposed to the patient or met his belongings without full PPEs should be listed as contacts. Also, laboratory staff that handle patient sample without proper biosafety measures. So, anything, as long as you came in contact with any blood or body fluids or contaminated surfaces or items from that patient, then you will be considered as a contact. Okay? For how many days we're going to follow these contacts? How many days? How many days we should follow these contacts? Remember your incubation period? So you should follow these contacts for 21 days. Okay? 21 days, you should follow this contact. You could either visit the staff personally, you can see him or her, or you can have a virtual assessment with the staff. Do you follow? You can ask the patient or you can ask the staff, how are you? How's your status? Do you have any signs and symptoms? Is Ansari giving you food? What else? Or are you dying? Okay? For sure, if you are dying or if you get worsened, the hospital will not accept you. They will refer you to government hospital. Imagine. And if you die, they will find another Indian to come here or Filipinos or any other workers. So your safety should always be your priority.
Okay.
Okay? It is very important for the healthcare workers to assess and to study. Do you follow? Now, these are the references that I use. The main reference for this lecture is from the Ministry of Health, Public Health Authority, Guidelines for Prevention and Control of Ebola and Marburg viruses. Version 1, October 2022. Then the other references are from CDC and WHO. Do you have any questions?
Waste disposal and the
Huh?
waste disposal other than
This room. Okay? What else?
also.
This morning I was asked, how does, it was Sir Bon who asked me, and I also asked myself, how? So Sir Bon asked me regarding this one. This one, how does bats, in what manner or in what mode of transmission does these bats could transfer the infection to other animals as well as to humans?
Usually,
Huh?
usually yung mga foods na na-infect nila. So, transfer lang sa ibang mga foods.
So let's say for example,
Provide the fruit and we
yeah.
create the fruit
for animals,
from bat to monkey.
yeah, it could be like that, but it's easy for humans, right? Especially if you're going to hunt animals that is infected with animals. That is, for example, for bats to antelopes, because it is seldom that they will encounter bats anyways, okay? Now, even scientists doesn't know where does Ebola really came from, okay? But they said that, the animals that is infected with Ebola virus are these animals, okay? But for how can it be transferred or where does it came from really,
Before the
there's no really researches or evidences that will tell us from where it came from. Okay? Now, Ebola virus, it was named in, where there are Ebola in one place that there is what we call as Ebola River. There, that's why it is called Ebola virus, because of that river name. Okay? What else? Any questions?
If you are doing any AGP means we can wear the N95 mask.
Of course, if you're
And
going to
after
perform
that,
AGP,
Can we discard the N95 mask or
yes,
we can keep?
discard alatul because that is highly infectious. Remember, one of our criteria for discarding our N95 mask, and if you're not going to reuse it, because we're reusing N95 mask, right? If your mask is already damaged, difficulty to breathe, soiled, aside from those criteria, if you're going to handle patients under contact precaution, discard your N95 mask. Any questions?
No question. Thank you, sir.
Try to answer this one. It occurs when an animal or human becomes infected with Ebola virus through contact with the reservoir host. What do you call that one? That is spillover. What is the reservoir host for the Ebola virus?
But
Bats. I will ask, come. This is the doping sequence. Can you tell me which one is the first and the last?
First one.
Come. Come here in front. This is your chance. Which one is the first one? This one.
Doping.
Yeah, doping. First is this one. Next.
This one. Second.
Where? This one.
Removing the outer.
Then
Then this one.
this one. Next.
And
This one. Next. Are you sure this one?
after your
Unsick first.
first this one.
This one. Mhm.
And sick.
This one.
Which after this one, first, second, third, fourth, fifth, then
Attendance daw. Online.
6, 7,
Ito
this,
ba ang dumating?
and last. Okay? Do you follow the docking sequence? Okay. But it's easier to remove PPE if you're just going to wear your yellow gown, right? Just follow the sequence in removing your PPE. Now, Ebola or your Marburg virus is detected in blood only after the onset of symptoms and may take up to 1 week for the virus to be detectable in clinical samples. True or false? Huh? True or false? It should be
Yes, yes.
3 days. Yes, Irene. Not 1 week. Okay? It is the period of exposure until the development of any signs and symptoms. What do you call that one?
Incubation.
That is your incubation period. Any additional questions? Now, there was also a question that was, because since this is the last lecture schedule,
Di ba overall yan, sir?
uh,
Paano natanggalin siya sus?
hindi na tinanggal dito, no? Ikaw na yung nakapansin yan, ah.
Paano natanggalin shoes pag galing mo lang hindi sa paa mo?
Wait. Di ba nakasali dito pag nasa ano? Hmm. The same manner pa rin siya. From up going pababa.
Nakaglaps ka ba rin sa pag
Tagalin mo na lang yung, di ba, outer gloves, then your cap. Next is your face shield, face mask, then your gown, then your shoe cover, then your gloves and the last. Okay? So every after removal of your PPE, you need to disinfect your inner gloves. Ito talaga si Sir Ryan. Kaya naka 102 eh. Iba. Any questions?
Sir, for any particular treatment for this?
Ha?
Any particular treatment they find out?
For your Ebola, I think it's most especially for, since it is a virus, you just need to treat symptoms most of the time. So it's more like of a supportive therapy or care. Oh, same with your dengue.
Symptoms, yun ang gagawin mo din.
Kung ano yung, what are the symptoms that is present, then
Yun yung treat
you should treat that one. If there's no symptoms, then you will never know it's Ebola. Yeah. Any questions? Did you understand? Okay. If there's no questions, thank you. Any question?
This is the status, this in the ID.
This is